In septicemia form, the bacteremia on the carrier state may be occur after invasion of blood stream occur, and the triple reaction, as I said before, is following in maybe 24 to the 48 hours, and the acute phase of disease and similar to the maybe seen in natural cases maybe, and is presented maybe 3 to 9 days later. The second form is the enteritis, maybe develop at the time of the first infection, or at the time of the time our animal is carrier. The third form is abortion, is commonly manifested in cattle, and this may be happened between 124 days to 270 days of gestation. Clinical signs, as I said before, there's three type of or three form of disease. In first form, in septicemia, is characterized in newborn calves or fowl, and in young pigs up to 4 months old. Commonly, there's depression and dullness and postration, high fever, and death occur within 24 hours to 48 hours. The second form, there's two type of it: acute enteritis and chronic enteritis. Acute enteritis may be common in adult animal of all species. There's high fever with the severe fluid diarrhea, because we know one of the typical signs for enteritis, it is diarrhea. Here we can describe the diarrhea in acute form. It is a fluid diarrhea, sometimes dysentery, and occasionally happened tenesmus. In chronic enteritis, we can concentrate on the calf. There is intermittent or persistent diarrhea, occasionally passes with a spot of blood and mucus and firm fibrous custis. And of course, also there's fever and loss of weight. Here, if we describe the difference between the chronic and acute diarrhea, we can say here a spot of blood and mucus with the diarrhea. Maybe we can differentiate between them. Abortion, here I consider a salmonella dublin that infect the calf. Maybe it happened spontaneously without previous clinical evidence of salmonellosis in the herd. This is maybe it can be a description about this form. The diagnosis of disease in general, if we're going to the diagnose the disease, we firstly going to see the symptoms or clinical signs of the disease and ask about the case history of this disease. If the disease associated with the bacterial infection, is the best way for identifying this causative agent by isolation and culture and the identification of this disease. We can here take sample from fecal sample, or even from the maybe different sample of this animal. A lesion, we can say here, concentrate on the hemorrhage and the mucoenteritis, and also if we have diarrhea, we think there is a changing habit in the intestine. We see thickness in the intestine wall, of course. This disease may be confused with the other disease that cause septicemia and enteritis on abortion. I listed here many diseases that causes septicemia and causes enteritis and causes abortion in the different type of animal. Uh, if we're going to treat this disease, of course, there is bacteria. So, if we have bacteria, we should use antimicrobial